Hospitals across the country are dealing with a nursing shortage. The turnover rate nationwide is about 14%. At UW Health, it's about 13%.
Well, the Bureau of Labor Statistics says in the next 5 years, we will be seeing a shortage of about 1 million nurses. Our Jamie Perez explored how this happened and what the UW is doing to make sure patients are still getting the care they need.
All right, so we're going to turn left into the procedure room here.
No one just wakes up and decides to become a nurse. It's not that kind of job. And certainly not for everyone. But Megan Schultz has been doing this for the last 13 years.
Heart rate, blood pressure, oxygen level.
It's something she was called to do at a young age.
I lost my father and my brother to accidental purposes of death, and this really changed my life and promoted me to become enthusiastic about learning, and the medical side of things has always intrigued me.
In the last 10 years, she and many others have noticed things shifting in this field.
We've been talking about the nursing shortage for about the last decade.
Kim McPhee manages the nursing residency program at UW Health. She says she's tried to stay on top of the shortage, but it's still not enough to keep up with the growing demand, especially as the healthcare industry expands.
So ambulatory care is providing care to patients in the community. So going to their doctor's offices, trying to get preventative care done in that arena, trying to prevent the need to admit patients to the hospital. So eventually, a lot of patients require hospital care, and so when they come into the hospital, they're sicker than they've ever been in before.
Right now, there aren't enough nurses to help care for sick patients. About 20 years ago, before residency programs were in place,
up to 60% of new graduate nurses left the profession in the first year.
And we are feeling those numbers today. Now, many of the nurses who are still working are getting close to retirement age. The Health Resources and Services Administration says more than 1 million nurses will reach retirement age in the next 10 to 15 years. The problem now comes from this, among other issues.
Well, it's difficult because we also have faculty shortages at the schools of nursing around the country.
Not enough nurses coming in means the ones who are there are overworked.
People are even offered extra shifts all the time when they're off.
And unable to provide the best care.
Nurses tend to be nurses at home too, and so therefore it's even harder because you don't really stop being in charge of or caring for other people, much less ourselves as nurses.
UW Health has been a leader in residency programs nationwide to help address this issue. What was once a 60% turnover of first-year nurses is now a 97% retention rate. They bring in about 175 new graduate nurses every year.
I think it's just the dedicated resources and attention. There's ongoing education for them. There's monthly classes where they're surrounded by other people who are going through the same situation they are. And that validation of feeling like I'm not alone makes a huge impact on your ability to adjust to this new complex role of being a nurse.
Fortunately, Madison isn't hit by the nursing shortage as hard as other places in the country. But Schultz knows it's still a problem, and she has a vision of the ideal situation in the coming years as hospitals across the country work to address the issue.
To have a lot of energetic, enthusiastic, dedicated, smart, of course, nurses that come into the field because they feel compelled to help people.
In Madison, I'm Jamie Perez, News 3 Now.
UW Health's nursing residency program even expanded by 50% last year to help drive the number of nurses that we have at our local hospitals.
Last year, they recruited 572 nurses and 302 nursing assistants.